everyone, I'm Dr. Evelyn from Petsadena Animal Hospital. I'm sure most of you have heard of the unusual respiratory disease that's going around in dogs in the Southern California area and actually in other states as well. Atypical canine infectious respiratory disease. Now, the name describes somewhat what it is in the sense that it's not typical because we're seeing this condition cause respiratory symptoms and have them progress very quickly and rapidly and not respond to conventional treatment. It's infectious, so we're seeing it spread very easily and very quickly throughout dogs if they're in kind of settings where there's multiple dogs, like boarding, grooming, dog parks, things like that, and they're all kind of inhaling and breathing in the same air. We are also seeing it affect the respiratory tract in particular. So we're seeing pets come in with symptoms of respiratory disease such as coughing, sneezing, discharge from the nose, trouble breathing, things like that. But we just can't put our finger on it. It's not a condition that we're used to seeing and or treating. Let's get some more information on it. I wanted to give you some more insights on what we know about it and what we might not know about it as well. So first, what is it? I went over what atypical canine infectious respiratory disease would describe. We just know it's a respiratory condition that when we run certain tests, like a respiratory panel looking for different infectious agents, we find that the test is negative. And the dog either has potentially signs of pneumonia on an x-ray, signs of bronchitis, and these symptoms are lasting long and they're not responding to conventional therapies such as antibiotics and cough suppressants. What are the clinical signs that you expect to see with this condition? Typically, we're going to see with any respiratory disease, potentially coughing, sneezing, nasal discharge, increased effort to breathe, faster breathing, labored breathing, and potentially respiratory distress where they're really gasping for air. So these are all the symptoms that we are seeing with this condition, and you don't necessarily see all the symptoms at once. You might see some, you might see others. So something to kind of keep in mind to make sure that if you notice any of these symptoms in your dog, that you contact your veterinarian right away and have them looked at as soon as possible. What causes atypical canine infectious respiratory disease? We don't know if it's a virus or bacteria. We do know that when we treat it with antibiotics, we're having a harder time managing it or treating it and curing it than we used to with a typical bacterial infection. Now, it could be a virus and that could be why, but it's not behaving the same way we expect our normal respiratory viruses that we're used to managing and seeing at the hospital. As far as treatment goes, depends on the severity of the symptoms. So if we have a pet that has pneumonia, we are using antibiotics to try to treat that. Again, we're having a difficult time finding the right antibiotic given that it's not responding the way we usually expect it to. We're going to try cough suppressants if we have a lot of coughing and no signs of pneumonia, maybe signs of bronchitis. We might give some medication for inflammation of the airways. Some of the typical antibiotics we use for respiratory infections also help with inflammation in the airways. We are trying to see what works best for these patients, and that's why the Los Angeles Public Health Department has asked us to report any of these unusual cases so we can start to gather information and get more insight on how to treat this condition. As far as symptoms go and treatment, if we are having difficulty with managing it, it can get very severe when the pet can be in respiratory distress and actually need to go on a ventilator. That's a device that assists the pet with breathing as the lungs heal. And in some rare cases, we've seen some deaths with this. So it is important that we try to identify whether a patient has this condition and try to start treatment as soon as possible. What to do if your pet has signs? There are a lot of other conditions, a lot of viruses and bacteria that can cause respiratory signs. So don't stress yourself out without talking to your veterinarian. So what I would recommend is that you schedule an appointment for a physical exam so that your veterinarian can examine your pet and make sure that there's not any other tests that we need to run, and or maybe run some tests to try to start to look at if it could possibly be this condition. Now, you might wonder what to do if your pet has respiratory symptoms and may have this atypical canine infectious respiratory disease. First of all, you want to contact your veterinarian. You want to make sure that you schedule an appointment to have them examined and make sure that there's not anything more serious going on. If they need to run tests to try to see if it's this condition or if your pet could benefit from other medications like antibiotics and cough suppressants. The other thing you want to do is to isolate your pet. Any pet with respiratory symptoms, especially if we don't know the cause of them and it could be this condition, should be isolated from other dogs for at least a minimum of 28 days to ensure they're no longer infectious when they have contact with other pets. If you believe your dog may have been exposed to a dog with this condition, then you want to make sure that you also quarantine your dog to monitor for symptoms to prevent them from spreading it to other dogs. You want to disinfect the areas that your dog has been in to ensure that whatever organism is causing this respiratory disease is not going to be picked up by another dog. Usually you want to use disinfectants that will easily kill most common bacteria and viruses to ensure that you disinfect appropriately. If there's something that can't be disinfected, it may be best to throw it away to ensure that we don't have any organisms living on surfaces that could potentially cause reinfection or infection to other dogs. Additionally, you do want to make sure that there's plenty of ventilation when you have multiple dogs in one area, so that if a dog does come down with something, that they're hopefully not breathing very significant amounts of whatever virus or bacteria they may be carrying, and you minimize the chance of spreading disease. Trying to avoid taking your dog to doggy daycare, to be boarded, to the groomers, if you can, until we try to get more information on this condition, and hopefully the outbreak starts to go away. You may be wondering how to prevent your dog from contracting the atypical canine infectious respiratory disease. Things are simple. Like we mentioned, trying to avoid contact with other dogs is one way. The other way is to protect your dog against other respiratory viruses and bacteria. That's important because a lot of times doggies can get more severe complications once they've already been infected with another organism. So make sure that your dogs are up to date on their Bordetella vaccination and their influenza vaccines. We want to make sure that the respiratory tract is nice and protected to hopefully avoid them catching this condition as well. Try to make sure that you keep your dog safe during this outbreak, and hopefully as we get more information, we will be happy to provide you with that. If you have any further questions or concerns, always feel free to give us a call at Petsadena. Thank you.